Today, Kentucky Governor Steve Beshear will announce whether to expand Medicaid to hundreds of thousands of people living right here in the Bluegrass. He says his mind is made up, but plenty of people are sounding off on this very divisive issue. WHAS 11's political editor Joe Arnold has more.
Governor Steve Beshear is expected to announce that Medicaid expansion at a 1:30 news conference at the state capitol. Louisville's uninsured can hardly wait.
Basically, I have to pay for it or out of pocket or, I don't get it done.
Tina Steyer is one of an estimated 400,000 Kentuckians who will gain access to Medicaid coverage if Governor Steve Beshear does as expected today and announces Kentucky will participate in the health care expansion under terms and reimbursement of the Affordable Care Act.
Obviously, from a health care standpoint, with Kentucky being one of the least healthy states in the country, it makes sense, if we can afford it, to get more people covered by health insurance.
But that's the sticking point. Can Kentucky afford it when the state has to pick up a share of the extra tab?
I think it would be better to have more information out there and more public discussion about it. It's something that will, again, have a tremendously significant impact. And certainly I don't want to see citizens out there who don't have health care coverage. But we have no idea what the long-term cost of this is going to be.
Yet at the Family Health Center's facility in the Portland neighborhood, the long-term costs of treating uninsured patients has been adding up for years. The executive director says this Medicaid expansion will not only address their shortfall, but probably lead to an expansion of their own facilities as the newly Medicaid eligible patients seek health care.
We're running an operating deficit right now because of the high percentage of uninsured patients. 53% of our patients are uninsured right now.
Medicaid was created to treat the poor, elderly, and disabled. This expansion would mean people with incomes up to 138% of the federal poverty line will be eligible. It's about $15,000 per year for an individual, about $31,000 for a family of four. Joe Arnold, WHAS 11 News.